My name is Julie Babbage. I'm the Executive Director of the Diabetes Patient Advocacy Coalition. And it's actually our first time coming to Alabama. So we're really excited to be here today. Lots going on in your state, lots of good opportunities to be engaging here. And we know it's a lot of your first time with us, actually. We had seen some of you say that you are new to Deepak in your registration. And so we're really excited to have you here. And it makes sense to be here. Over 14% of the adult population of Alabama has diagnosed diabetes, and there's another 35% with prediabetes. So it is very prevalent. It is very much something that we know many of you are passionate about because you have a personal connection to it. And some of you are type 1, type 2, parents of children, caregivers, friends. So thank you so much for being here today. I'll go over our agenda briefly. Welcome and introduction. And then an Alabama legislative overview. And we have a special guest with us today. Representative Charlotte Meadows is joining us for that discussion. Then we're going to take us all through Diabetes Advocacy 101. So especially for those of you who are new to advocacy, it's going to talk about some of the hottest topics in diabetes policy, some of the things that you're hearing discussed in the news or that you may see on social media, skills for effective advocacy. So how to be an advocate and a Deepak champion with us. And then we'll wrap up all today in about an hour. So we will dive in first here to a quick overview of Deepak. Oh, just kidding. We'll do some housekeeping notes first. So if you've got questions for our presenters, use the question and answer feature at the bottom of Zoom. And if you're experiencing any technical difficulties, just reach out to us. You can message us through that feature as well, and we'll help you get that started. Again, this meeting's being recorded and is being streamed to Facebook Live to an audience there. And now we will get started with a quick overview of Deepak. So our mission is to ensure quality of and access to care, medication, and devices for people living with diabetes, and to inspire all of us, patient advocates, as well as lawmakers, toward meaningful action for diabetes. And we do that by having events like today. We have trainings, we have Hill Days, advocacy days. We've got a lot going on. So be sure to follow us there. You see at the bottom our social media so that you can stay tuned to all the things that we have going on. We also, our sister organization is the Diabetes Leadership Council. We work together kind of as two sides of the same coin. Deepak is the advocacy arm, the action arm, and DLC is really the policy side of things. So they're reading bills and weighing in on the early side of the legislative process, and really are key to our ability to be successful as a grassroots army of Deepak champions. So really glad to be affiliated with them. And next slide. So we're going to get right into the exciting part of our presentation today, starting with just a quick overview of where Alabama is on what we call a scorecard. So we'll take a look at the landscape really of things in Alabama. If we can switch to the next slide. So this is something that we use to see how states are stacking up against legislation we track nationally. What you see here is a list of things that are being talked about, are being worked on, are being passed in other states, things that Deepak supports. And we want to check in just to see how Alabama stacks up. So you guys have passed an insulin copay cap, and that was just signed into law in 2021 through House Bill 249. It caps the copay at $100. And there are only 22% of you today who have said that you've used a copay card. So we talk a lot at Deepak about affordable access, about available assistance programs, and that's certainly something that we want to touch on today. And if you've got questions about that specifically, we'd love to chat with you. We'll talk copay caps a little bit later on. And we also in Alabama have CGM coverage and Medicaid for type 1 and type 2 with standard qualifying requirements. So we're really pleased to see that. Several of you mentioned in your registration that you were particularly concerned or interested in understanding more about CGM. And we also have seen that consistent with other state forms that we have, 26% of you, around roughly a quarter of folks, up to 33% on average, say that they have rash in their insulin, which we never want to hear or see. And so again, that's why affordability and access are so key to our mission. and to the work that we do. You see a little briefcase icon on a couple of those items here. So the copay accumulator ban is a really important piece of legislation that we've seen, again, making its way across states, and has a bit of a challenging name to really parse out what it means. So we're going to go through that a little bit later in our hot topics discussion, as well as rebate pass-through. So really exciting to see that Alabama has is working on two important pieces of legislation that Deepak really has on our priority list. Next slide, please. So I'm going to introduce to you Stuart Perry, who is going to moderate our panel with Representative Meadows. Stuart is a tireless advocate of people with diabetes for decades. He himself has type 2 diabetes and numerous other family connections, including a son with type 1. He is the volunteer vice chair of Deepak, and he lives in Kentucky. And his day job is that he owns and operates a State Farm insurance firm. So we are so excited to have him here with us as a person with diabetes to interview our representative here today.
Thanks, Julie. Appreciate it. For today's panel, we're very grateful to have a legislator and a champion for people with diabetes. She was first elected to the Assembly in 2019. Representative Charlotte Meadows represents Alabama's 74th district in Montgomery County. During her time in the legislature, she has served on both the Health and Education Policy Committees, among others. She earned a bachelor's degree from Auburn, which Representative Meadows is where my daughter is currently attending school, and an MBA from Southern Alabama University. Outside of her work as a legislator, Meadows works in the education field, serving as the chair of a lead academy in Montgomery. Representative Meadows, thank you very much for agreeing to come and share with us today. I'm looking, I think you need to slide the thing on your computer. There you go, so that we can see your smiling face. Meadows, thank you very much and welcome.
Well, thank you so much for having me today. And let me start by saying more Eagle.
More Eagle, that's exactly right.
And next time you come to Alabama, maybe we can get together in person. I'd love to show you around.
Yes, ma'am. My daughter rides horses for their NCAA championship equestrian team. So
wow, I bet we have some friends in common then. I've got a really good friend whose daughter also rides horses. You've probably met her. Anyway, it is a real honor. It's a real honor to be with you and all of the Deepak group today. I'm looking forward to learning more. And I'm excited to be able to participate in this program.
Well, thank you. It's very important to all of us in diabetes advocacy to have people like yourself that care enough about the disease and about the people with the disease to stand up and be a leader. So everybody has a connection to diabetes, Representative. What is your connection and why do you even work on diabetes issues?
I was going to say, well, I care enough because I have diabetes.
There you go.
Coincidentally, I have a twin sister, and we were both diagnosed within a few weeks of each other, right about the time we were turning 45. So I'm going to tell my age here if anybody can do basic math, but about 15 years ago, I went for a regular, I guess, OBGYN type checkup, had blood work done, and the blood work came back. I guess they ran an A1C at the time, and it was not what they wanted to see. So that was the beginning of my introduction to diabetes. And then literally about 2 or 3 weeks later, my twin sister had the same type of diagnosis, basically the same way. So, you know, if you have a twin, expect it to follow. But and at the time, I remember really well going to a doctor, an endocrinologist, sometime early on, and he said, well, you picked the wrong parents. And of course that was very offensive to me because my parents are wonderful people. They're both still living, they're in their 80s, and neither one of them had diabetes, had no family history of diabetes that we knew of from grandparents. So it really came out of the blue. And yeah, I was a little overweight, but I didn't perceive myself to be like obese or huge or anything like that. So I was really very surprised, and it made a huge change in my lifestyle. Of course, it was a blessing, I guess, that my twin sister and I could do all that together and go through it together. I've always had a doctor that was a little bit more aggressive in treating my diabetes. And so she has taken advantage of my trying out different prescription medicines and things like that. and made suggestions to her doctor. She lives 3 hours from me in North Alabama. So we've gone through it together. We don't have, none of our children are diabetic. Neither one of us had diabetes, gestational diabetes when we were pregnant, which she has 2 children, I have 3. But in just the last several months, my father has really been diagnosed with diabetes at age 82. So now I'm kind of like, well, that's where it comes from. And he has always had a very, very active lifestyle. And his A1C has now crept up to like 7.7. So he is not happy with that, and trying to treat it with lifestyle changes, food, and a little bit more exercise. But anyway, so it's been a very interesting journey.
Well, Representative, you gave a few keys there as to why on this next question I'm getting ready to ask you. But you and your colleagues sponsored legislation that promoted some of our Deepak's priorities, which is access and affordability, which is exactly what you just talked about. So can you talk to us a little bit about HB 249, last year's copay cap, and help us understand how it can help people in Alabama with diabetes?
Sure. That was the first year I was actually on the health committee. I was elected in 2019 and then actually was offered the position of joining the health committee at the end of my first year. And so I was on the health committee, but that bill did not go through the health committee. It went through insurance. So it came to the floor. Chairman Lee was carrying the bill. He's the chairman of the health committee, but he took it through insurance. And that's a whole different process, how those things get assigned. But it was an easy thing for the House to pass, and I'm pretty sure it must have been relatively easy in the Senate too. My concern is that it really didn't do enough, because $100 a month is kind of expensive for some people, actually for a lot of people. So I've never had to not be able to afford to pay for my medicines. I'm fortunate that we've always had relatively good health insurance. And Medicaid, I think, covers, for those people in Alabama who have Medicaid covers diabetic supplies and things like that in a pretty good way. The problem in Alabama is we have so many people who don't have insurance, who are either completely uninsured or really underinsured. And we also, I believe, have a higher prevalence than normal across the country of people in the state who have diabetes, because we have so many people who are just obese. And if you're in Alabama this month, you might know that we have a very sedentary lifestyle, because it's just so dadgum hot outside. You can't get outside and move and do things that you might want to do. So access, affordability is a problem from the angle that many people don't have health insurance.
Yes, ma'am. And being from Kentucky, we're part of the diabetes belt, just like Alabama. So you also co-sponsored HB 492, which tried to rein in the evil giants that we call PBMs. It didn't hit the governor's desk. So are you working with your co-sponsors to bring that back?
Yes, that bill had, I thought, a lot of momentum going into the session. Senator Butler is actually a pharmacist, and he carried it and sponsored it to begin with. And as soon as I heard about it, I was like, oh, I want to hear about that. My husband is actually a physician in Montgomery, so he works with PBMs a lot and tends to say, curse words in front of the PBM name. So, I mean, I had an intrinsic idea that, okay, PBMs are bad, pharmacists are good. We have to, but it is a situation that we obviously have to work within the confines of what we've got. But the bill that Senator Butler brought, I thought would have really gone a long ways towards helping us have equitable access, I guess, across the board. It's hard to get a bill passed. I had a really easy bill that I worked on for 3 years that nobody was opposed to. And I finally got it passed this last year. And it was like, this is why it's so hard to get good legislation, because it's just complicated. I mean, you have to have all the timing right, and everybody has to be on board. And then you have to get down to sometimes you literally get down to the last day. and things just don't go your way or whatever. So I do think that the pharmacy benefit manager bill will come back and probably be even stronger.
Good.
I had a lot of people making contact from pharmacists. I mean, my local pharmacy, who I visit unfortunately quite regularly, had a little flyer in their window saying, please contact your legislator about this bill. And I got a lot of people contacted me because of the pharmacy saying to do this. I'm quite sure that pharmacies around the state were on board with that. I mean, I use a private local pharmacy, so I don't use a big chain.
So let's switch gears just a little if we can. As you well know, it's been well reported that COVID, as well as diabetes, has had a disproportionate impact on certain segments of the population in Alabama as well as elsewhere. And we generally call this health inequity. So what are the leaders in Alabama doing to address this for communities of color?
Not enough.
Good answer.
I mean, it's a true answer. I think Alabama, actually, there was a report that came out just a couple of weeks ago that indicated that Alabama was one of the worst states at dealing with COVID in the country. And I really have a lot of respect for our Department of Public Health. I'll start out by saying I've got a good relationship with Dr. Scott Harris and the people in his staff and on his team. However, the department and Dr. Harris did not do a good job in making sure that patients had access across the state. And I came to learn that very personally. I had constituents that were trying to get access to COVID shots for their loved ones who were in like a facility, like a nursing home. And I mean, I literally had to threaten to go to the press to get them to get access to those shots. So it was, just a real, I'm going to have to think about the proper word to say. Some people might call it a shit show. We won't say that on Zoom. It was a mess how they were trying to get people to be able to access the COVID shots. So, that combined with, we'd never had even a virtual access law in the state of Alabama until this past session. So we did pass a piece of legislation that gave access to virtual visits, which thankfully the state was using federal waivers during COVID for all their virtual type of visits. But that made a big difference, but it hasn't been happening for very long. So there's a lot of inequity in the state of Alabama, but particularly going back to in our rural places, in our rural counties, they don't even have broadband. So they can't do virtual visits for COVID or for diabetes, which diabetes would be if you could get your blood sugar checked every 3 months for an A1C, you could easily do your visit with the virtual visit with the doctor or provider of some type.
Well, I'll tell you what, just listening to you gives me hope for the people in Alabama, because you're obviously a very passionate advocate on behalf of them for healthcare matters. And we haven't even gotten into education, Representative Meadows, but I'm sure you're there as well. So in the short amount of time we have left, let me ask you a really, let me call it a softball question, but I'll let you hit it out of the park.
Okay.
What is the best way for a smart advocate in Alabama to help you and work with you to engage their representatives and help you get these done? A lot of times we hear just a couple people can get lawmakers' attention. Is that true? And what's your recommendation to people that are listening to us on how they can help you and get involved?
It's very true that just a couple of people making contact with their state representative or their state senator can make a big difference. Can you hear me okay? Because we were.
Yes, ma'am.
Okay. And when it comes to making that contact, having a personal relationship with your legislator is really important. And I live in Montgomery. I shop at the Publix in Dalrata. I go to Sam's Club, once a week. I shop around town. So if I'm shopping and a constituent sees me, then I would really like for them to come up and say, I'm so-and-so, I live in your district, I want to introduce myself. And that does not ever, that would never offend me. But getting to know the person that represents you, I think is really critical. And then if you have diabetes and now you know that I have diabetes, that gives us a really great connection that, I mean, I can certainly empathize with anybody out there who's dealing with it, if it's a new diagnosis or whether they've had it for 15 or 30 years. I mean, I've been through something over the past year where we changed insurance 3 times in 6 months. And that became a living nightmare. And I have a husband who's a physician who knows how to deal with it. And it still was very difficult for me to even get strips called in. I mean, and I had the blood glucose monitoring system last year, and it was very useful, but it was also very frustrating from time to time. Anyway, I have a lot of empathy for anybody who has diabetes because I've been there, done that, and got the t-shirt. So if we're working on legislation, you know, first of all, I mean, I can get it written. I just need to know what are we asking to do? And then if there's people that live in other parts of Alabama and they have relationships with their legislator, and they can, in fact, I did get an email response. I think I mentioned to Jacob on the email the other day. A couple of my colleagues have already been approached by somebody in their district that they're looking at wanting it to do some kind of legislation. I emailed back and said, let me know what I can do to help. And that's specifically something to do with diabetes. I don't know what they're asking is, but whatever it is, if there's 2 or 3 of us, I mean, a lot of times you see a bill that comes along and it has one sponsor, and that's fine. But if you see a bill that has 15 or 20 sponsors, then that makes you think, okay, this bill is going to go somewhere. And particularly if there are 15 or 20 sponsors who have 15 or 20 people back home that are saying, we really want you to get this done this year, right now. And it makes it much more easy to get it across the finish line.
Right. Well, Madam Representative, let me say this. I have been an advocate for over 30 years for diabetes, and I've worked in many different states. I've been in all state capitals but 2. And as a person with diabetes and a diabetes advocate, let me thank you for what you're doing, because it gives me great hope for the people of Alabama and the people with diabetes out there to know that someone like you is willing to stand up and be a champion. So thank you very much. Thank you for coming today and sharing with us. Thank you for all that you're doing, and do more. That's the one thing I would leave you with. Thank you for what you're doing, and do more.
Do more.
And you are welcome to stay and listen to the rest of the show, because you might find it as entertaining as you did the Texas one you watched. So thank you again. Julie, I'm going to turn it back over to you.
Sure. No, I just wanted to say my own thanks to you, Representative Meadows. First, thank you just for sharing your amazing story, because that's something that we do a lot as advocates. You know, that you had your twin sister by your side, and your father, that just proves there is certainly a genetic component, and just, you know, that you understand diabetes firsthand, and your work on affordable healthcare. I mean, even your recognition that $100 copay cap is still, frankly, too high, and Deepak thinks so too. So we really appreciate your candidness and your honesty and your sincere responses, especially for your empathy as a person with diabetes. And that last bit, your openness to hearing from constituents, you know, advocates on the call, on Facebook Live, take note that that you heard it firsthand. Lawmakers want to hear from you, from us, on the things that we care about, and that us raising our voices, as you said, and I quote, makes it easier to get things across the finish line. So understanding together that's possible, because we talked to you about it in the grocery store. We, you know, approach folks like you and let you know the things that are on our mind is really powerful. So thank you for that.
Thank you.
Awesome. All right. We will transition into the next part of our conversation, which is a look really briefly at the national picture. So today the focus is on states, but we do want to talk briefly about what things look like from the congressional standpoint, because that's an area that Deepak works really closely on too. In Alabama, you have two senators. You have Senator Richard Shelby and Senator Tommy Tuberville, both, and also this overwhelmingly Republican presence in Congress. So always good to note the dynamics of state and the number of folks that you have representing you in DC. A big change this year is that Senator Shelby, who was first elected 36 years ago, is not seeking re-election. So that means that there will be a general election that will be an open seat. Deepak works, like I said, a lot in Congress, and we just had our virtual Hill Day where we talked to folks like the senators and the House members one-on-one, or sometimes with a group of advocates from the state, to share with them the priorities that we have. We specifically talked about insulin copay caps at the national level, which would help the majority of people across the nation. So Alabama, of course, as you just heard, passed its own copay cap, but the state caps are really only applicable to about 10% or so of the population in that state. You may have heard of the Insulin Act legislation, which is authored by two diabetes caucus leaders in the Senate. And that's great to switch to the next slide, because it is actually a good opportunity to talk about the caucus here. This is a group of lawmakers in the House, and there's also a Senate caucus who have said, I am somebody who thinks that this is important. I want to work on issues related to diabetes. And it is actually the largest health caucus in Congress. So we're really proud of that. And it's a good way for us, our congressional work is a good way for us to make sure in an election year, especially, that people aren't just using diabetes as a political football, saying, oh, look, we're suddenly interested, or we're trying to do something and not really moving the needle. So there are a lot of chances to get involved with Deepak at the federal level. Stay tuned for more Hill Days. And we really are going to really focus, again, the majority of our work today on the state picture, but wanted to briefly mention that. And if you don't know who your members are, you can look them up on the last slide, there was a resource at the bottom of the slide that lists just that URL. So house.gov/representative. You can also do the same for the Senate. And we'll transition back into the state picture, which will be a similar way that we can view that on the next slide. So you'll see that there is Alabama Governor Kay Ivey, who, as we mentioned, it's an election year. She is up for re-election, along with the House and Senate. And you can see there, based on the Republican governor, Republican Senate, and Republican House of Representatives, that Alabama is one of 23 Republican trifecta legislatures, where all three of those positions are held by the same party, and one of 24 veto-proof supermajorities. So that just means that, and actually Representative Meadows was just kind of going through this, that if you see a bunch of co-sponsors on a bill, or you can kind of look into the legislative landscape a little bit when we're monitoring legislation. And it just means that if the bill is sponsored by Democrats, it's going to need some Republican support to pass and ultimately get to the governor's desk. So just good information to be aware of as we advocate. Both chambers are elected to 4-year terms with no term limits. So there will be some elections this year for the state House and Senate as well. Really, it's great at the state level. As you were just hearing from Representative Meadows, folks are out and about in the neighborhood. The members of the House and the Senate, you might run into them at the grocery store. They're just a few minutes or a few hours away from you at the state capitol versus days at the U.S. Capitol. So state leaders are more accessible or more available to you in the community, and they want to hear from you. And the great thing about state advocacy as well is that we don't see these giant 1,000-page bills like we do in Congress. So it's easier actually to track a bill at the state level through the process, which is our next slide. Just to briefly run through with you, we know the dynamics, the House and the Senate. And when a member sponsors a bill, there are a lot of steps that have to happen, as you can see on this slide, from the time that the bill enters the process to the time that the governor, in this case, Governor Ivey, gets the legislation. And so each time you see those box colors change, from the House to to the Senate or Senate to the House is an opportunity for us to get involved. And Bill, you see the image there of Schoolhouse Rock, notes in the song that it's a lot of bills end up dying or failing. And so this is a really just a good opportunity for us to note that in our role as patient advocates, we can be present throughout the process and make sure that the bills that are important, especially the ones that we mentioned that are being worked on, can actually go through and make it to the governor's desk and then be law. And with that, we will go over to the next piece of the last really piece of today. Thank you so much for sticking with us. We've got just a couple minutes left, and we want to get to how do you start advocating? So you've heard all of these issues, you know what's happening in Congress and in your state. And so how do you actually get to take action? You can do that by joining us right now on the website. We actually have action for you to take. I'll show you on the next slide what that looks like, but there is action to take right now. Deepak sends out action alerts. We have newsletters. We have all kinds of ways of telling you, whether it's via email or via social media, when there is an opportunity for you to take action. We'll go back to that slide really quickly so I can run through the other events that we have. We have virtual and in-person Hill Days. We have brown bags, policy briefings, social media. We have ways of communicating with you to make sure that you don't miss an opportunity with us. And again, our social media is right there at the bottom. We do say a warning that action happens at government pace. So sometimes we go back and we ask the same thing several times. We just did that with our virtual Hill Day. We had asked for things last year and we asked for them again this year, and we had seen incremental improvement. We saw more co-sponsors added to congressional bills, which was really exciting. We saw them move a little bit further in the process. We came back to say, hey, we're still watching, we're still here, and these things are still important to us to help to move them across the finish line. And the same with state work. We're really excited for the couple of things that are currently in process in Alabama, and for the opportunity to get to be involved in those when the session starts again. On the next slide, you'll see right now you can go to our website and you can take action on the Insulin Act. You see improving needed safeguards for users of life-saving Insulin Now Act, which is just a really great opportunity to make those copay caps that we've been hearing about at the state levels finally apply outside of states to cover so many more people in the fight for low predictable cost sharing. And so we're really pleased with that. You see that there are other parts of this bill that we really like, and we'll give that full option for you in that right up on the previous slide, if we can go back, which is just showing you that there are many things that we'll say, and then you have the add personalized message. So you get the chance when you go through this, it fills in your representatives, and then you get the chance to add your own story, which is so important to why this matters to you personally. And then with just the click of a button, you can tell your member of Congress and their office that you really would like for them to support this legislation. So there are a lot of opportunities like this. This one is active now, and we would love to have your support. And then our last slide here is just, again, a little bit of a recap to say thank you, first and foremost, for attending. Thank you for wanting to learn more about state advocacy and advocacy with Deepak. We're really excited to have so many of you joining this network. Please sign up if you haven't already to follow us on social media, share it with your friends and family, and practice telling people and telling your members of Congress your story and why this is so important to you. We'll go ahead and wrap things up. Want to say thank you again, and we hope that you have a great rest of your day. Thank you so much.